Nobody at Eastbrook Veterans Medical Center wanted to spend another minute on the Marine in room 308. The doctors called him a ceiling case. The charge nurse called him a safety issue because his left hand still threw objects when orderlies moved him wrong. The attending neurologist, Dr. Gerald Braun, had used the phrase warehouse candidate twice in morning rounds, quietly enough that residents could pretend they hadn't heard it, loudly enough that everyone understood exactly what he meant. Only one nurse in cerulean blue scrubs thought the Marine was trying to say something. Before we get into this story, welcome. I'm glad you're here. If this one pulls you in, hit the like button, leave a subscribe, and drop a comment telling me where you're listening from. I love knowing how far these stories reach. Now, let's begin. Eastbrook Veterans Medical Center sat at the edge of Phoenix, where the desert heat pressed against the glass and made the hallways feel smaller than they were. The neurology ward on the third floor smelled of antiseptic and recycled air. Gunnery Sergeant Thomas Dalt had been in room 308 for 4 months, 2 weeks and 3 days. Fiona Cassidy had been counting. She wasn't his primary nurse. She wasn't supposed to be. Her assignment was the East Corridor, 6 patients, charting done by 7, out by 3 if rounds ran clean. But she passed room 308 twice a day, and twice a day she slowed down. Dalt lay beneath a standard issue blanket with his eyes half open, the way eyes looked when the brain had stopped telling them what to do. He was 39, built like a man who had carried weight for a living, because he had. Marine Force Recon 3 deployments, a commendation list that was partly classified. A vehicle-borne IED outside Kandahar had done what 13 years of combat hadn't. The blast left him breathing on his own, which the staff considered fortunate, and left his higher cognitive function in a disputed gray zone, which the staff considered expensive. Dr. Gerald Braun had resolved that dispute 4 weeks after admission. Minimally conscious state with no functional recovery pathway, he had written in the file, and that sentence became the shape of Thomas Dalt's world. Fiona had read the note 3 times, each time something in it sat wrong. She was 36 and had worked the neurology ward at Eastbrook for 14 months. Before Eastbrook, there had been a different city, a different hospital, a gap in her employment record she described to administrators as transitional, and to no one else at all. She wore her brown hair pinned back, her cerulean scrubs loose at the shoulder, and she kept her eyes down around Braun the same way you kept your head down around indirect fire. Not from fear, from discipline. She had learned that discipline somewhere most nurses hadn't. On a Tuesday in October, Fiona was restocking the medication cart outside room 308 when she heard it. 3 taps, a pause, 2 taps, a pause, 1 long tap against the side rail. She stopped. 321 was not random agitation, it was a pattern, and Fiona Cassidy recognized it the way you recognize a language you spent years trying to forget. She stepped inside. Dalt's left hand rested against the aluminum rail. His eyes were aimed at the ceiling, his face showed nothing, but his index finger moved again. 3, 2, 1. In Marine Force Recon, when radio silence was mandatory, when noise meant death, a team used modified patterns tapped against stone or skin or steel. 321 meant I hear you, I'm here, don't stop. Fiona pulled a chair to the bedside. Gunnery Sergeant Dalt. She didn't use the loud, careful voice some staff used with him, the kind that assumed the listener was either fragile or absent. 321, I hear that. The finger went still, then 1 tap, hard. Yes. Fiona's hands went cold in a way that had nothing to do with the air conditioning. She didn't tell Braun that morning. She had learned, across 14 months at Eastbrook, that information shared too early, with the wrong person became information used against the patient. She told no one. She went home, sat at her kitchen table with a glass of water she didn't drink, and thought about what she had heard. The next morning, she brought a laminated alphabet board from the pediatric supply closet, and told the desk nurse she was trying a communication protocol with room 308. The desk nurse looked at her, the way people looked at nurses who had opinions about minimally conscious patients. Fiona looked back the way she had learned to look at people who underestimated quiet. She sat beside Dalt for 20 minutes before he tapped again. 321. She held up the board. Can you use this? Tap once for yes. 1 tap. Her heart did something complicated. She pressed it down. I'm going to go through the alphabet. Tap when I reach your letter. It took 11 minutes to spell 3 words. His fingers shook, his face stayed still, but the letters came. HEAD, AA. Fiona wrote it in her personal notebook, not the chart, not yet. She came back the next day, and the day after. By the end of the first week, she had documented 6 exchanges. Pain, worsening, blurred visual field left side, pressure behind his right eye that had started 2 weeks earlier and hadn't stopped. He couldn't scribe's pressure yet. They hadn't gotten to abstract words, so he spelled heavy. He spelled wrong. She took her notes to Dr. Braun on a Thursday morning during his post-rounds coffee break. the window she'd identified as the one where he was least likely to perform for an audience. She set the notebook on the table and stood beside it. Braun looked at it without picking it up. What is this? Communication log. Room 308, Gunnery Sergeant Dalt. Tapping pattern, modified field code. He's been responding to direct questions for 8 days. Braun picked up his coffee instead. He agitates against the rail, we've documented that. He's spelling. Nurse Cassidy. He set the mug down with the particular gentleness of a man managing his temper. I reviewed his imaging. His MRI on admission showed diffuse axonal injury consistent with severe blast TBI. His Glasgow score on arrival was 6. I've been practicing neurology for 22 years. His pain pattern has changed in the last 2 weeks. Pain behavior in minimally conscious patients is unreliable. He isn't minimally conscious. The word landed badly, which was the only way it was going to land. Braun's expression shifted into one Fiona had seen before, on different faces, in different rooms, on men who held authority the way they held car keys, never thinking about it, never questioning whether it should be theirs. You've been here 14 months. In that time you've questioned 1 transfer, 2 dietary orders, and now my primary diagnosis. I documented patient safety concerns. You documented instinct. Fiona said nothing. An old sound rose in her, rotors, wind, the particular static of a radio trying to reach her through a sandstorm. She pushed it down. She was a nurse here, only a nurse. Mr. Dalt has a family, she said. His wife visits on Saturdays, his daughter is 11. If there's a treatable component to his deterioration. There is no treatable component. There is a catastrophic brain injury with a prognosis I am confident in. He picked up his mug again, the signal the conversation was over. Do not bring speculative communication exercises to my attention again. Yes, doctor. Fiona picked up her notebook and walked back to the east corridor, where she spent the rest of her shift doing exactly what she was assigned to do. She checked 6 patients. She updated 6 charts. She didn't make a scene. She had learned long ago that scenes were for when you had no other options, and she wasn't there yet. That afternoon, she filed a formal patient safety observation through the electronic system. The tapping exchanges, the letterboard responses, the reported change in pain pattern, and the discrepancy between the documented no purposeful movement and 8 days of consistent, patterned, responsive tapping. She knew what would happen to the form. She filed it anyway. In any system, paper mattered more than arguments. On Saturday, Dalt's wife came. Cora had the look of someone who'd been bracing for bad news so long her face had reorganized itself around the posture. She sat beside Thomas for 2 hours, talking in a low voice about their daughter, about the yard, about a dog they'd apparently promised to buy before the deployment that had ended this way. Fiona passed the room 3 times. On the 3rd pass, she stopped at the door. Cora looked up. He moved his hand when I told him about the dog. She wasn't sure whether to be hopeful. She'd been in this position before, hoping too much. I know, Fiona said. Do you think he understands? Fiona held the doorframe. She had been trained across every system she'd ever worked in to be careful with hope. False hope caused real damage, but she also knew withheld hope, delivered as professionalism, had its own cruelty. I think he does, she said. I think he's been trying to tell someone for a while. Cora pressed a hand over her mouth. She wasn't a loud woman, and she didn't cry loudly, but her shoulders shook once hard and Fiona stayed in the doorway until they stopped. The following week, Braun transferred Dalt to his outpatient consultation list for long-term placement review. Hospital language for moving a patient to a facility that cost less and promised less. Fiona read the notification at 6:47 in the morning and stood at the nurse's station a full minute before she moved. She called neurosurgery at 7 and asked for whoever was covering TBI consults. A resident named Dr. Priya Anand called her back at 7:20. I have a patient in room 308, Fiona said. Classified minimally conscious, scheduled for long-term placement review. I have 8 days of documented purposeful communication and a reported change in pain pattern over the last 2 weeks. I'm asking for an independent assessment before transfer. Anand was quiet a moment. Who's his attending? Braun. Another pause, the kind Fiona had learned to read. This one meant Anand knew the territory. Send me your documentation, Anand said. I'll review it today. Fiona sent the file at 7:31. By 9:15, Anand was on the ward with a tablet and a resident, asking for the chart on room 308. Braun wasn't on the ward. Fiona had checked his schedule, and that hadn't been an accident. Anand sat with Dalt for 40 minutes. Fiona watched through the window in the door. Dalt's hand on the rail, Anand leaning forward. Then the moment Anand understood, it looked the same on every face, the small controlled stillness of someone recalibrating everything they'd assumed. She came out changed. He responded to 11 out of 12 questions, consistent, patterned, purposeful. Yes. How long have you known? 8 days officially. I suspected longer. Anand looked at the chart. Braun cleared him for long-term placement. I know. That paperwork goes to administration next week. I know that too. Anand studied her. She was young, younger than Fiona, but had the quality of someone who decided early not to waste time being afraid of the right thing. I'm ordering imaging today. Full MRI with contrast, vascular sequences. If there's something evolving in there, I want to find it before he leaves this building. Braun appeared at the end of the hallway at 11:40. He saw Anand's imaging order at 11:43. He was at the nurse's station at 11:45 and nothing about his face was controlled anymore. Who authorized a consult on my patient? I did, Anand said, at the request of nursing staff following a documented change in status. There has been no change in status. I reviewed him Tuesday. With respect, the nursing staff has documented 8 days of responsive communication that isn't reflected in your Tuesday note. Braun looked at Fiona, the look of a man deciding which kind of anger to use. Nurse Cassidy filed that documentation. I did, Fiona said. You were told. I documented a patient safety concern. That's within my scope. Braun turned back to Anand. Cancel the imaging. I can't. The order stands until reviewed by department chief or patient advocate. I am his attending. And I'm a consulting physician with documented indication. If you'd like to escalate, I'll have the file ready. His jaw set. He looked at Fiona once more. You have created a liability issue. I've created a paper trail, she said. That's different. The imaging ran at 2 that afternoon. Fiona had no clinical reason to be in the room, and she knew it, so she waited at the nurse's station, charting the East Corridor's afternoon vitals, with the focused attention of someone performing calm so her hands would believe it. Anand came out of radiology at 4:17. Her face changed again. She found Fiona at the medication cart. Epidural hematoma, she said quietly. Posterior fossa. Small but active. Been developing at least 2 weeks, probably triggered by a minor fall. His chart documents as a repositioning incident 3 weeks ago. Fiona had flagged that incident. It had been logged as a routine positioning complication. Can you decompress? Yes, if we move now, it's operable. It's the reason his symptoms are worsening, if we leave it. Don't tell me what happens if you leave it. No, Anand said. Okay. The next 2 hours were logistics and resistance. Braun had to be notified. Hospital protocol required it. He arrived with an administrator named Douglas Fitch, who carried a folder and the expression of a man calculating exposure before he'd heard the situation. Braun reviewed the imaging in silence, then said the word artifact. The word people used when they needed the evidence not to be real. Anand pulled up 3 views. This is not artifact. A hematoma of this size is consistent with every symptom Gunnery Sergeant Dalt has communicated over the last 8 days, which is documented. She glanced at Fiona, thoroughly. Fitch said, there will need to be a review of the communication protocol before surgery consent. He can communicate, Fiona said. I can demonstrate it right now. Nurse Cassidy. Get the consent form, bring it to the room. I'll walk him through it. She has no authority to obtain surgical consent, Braun said. Then stand beside me and tell me what you see. The group moved to room 308 with the energy of people who'd stopped agreeing and hadn't yet decided who would win. Cora Dalt was there. She'd come back that afternoon, as she did most afternoons, because she had nowhere she'd rather be. She stood when they entered, reading the size of the group the way military families learn to read groups of people at the door. What happened? Anand explained the imaging, direct and clear, without false comfort or unnecessary catastrophe. Cora listened with her hands clasped at her sternum. Fiona moved to the bedside and picked up the alphabet board. Thomas. She used his first name. They'd been doing this 8 days, and she wasn't going to formalize it in front of an audience. We found something in your head. A small bleed, pressing on your brain. It's been making things worse. They can remove it. I need you to understand what I'm asking. His finger was still. She waited. 3 taps, 2, 1. I hear you. She exhaled through her nose. Do you understand that surgery could have risks? 1 tap, yes. Do you understand that without surgery this gets worse? 1 tap. Do you want Dr. Anand to operate? The finger moved once, hard, fast. Yes. The room went very quiet. Cora pressed both hands over her mouth. The resident behind Anand stopped writing. Fitch's folder lowered 3 inches. This is anecdotal, Braun said. A blink pattern. A tapping pattern, Fiona said. Documented, consistent, purposeful, 8 days. It does not constitute legal consent. It constitutes evidence of cognition, Anand said, which changes his classification, which changes every decision this hospital has made about him in the last 4 months. She looked at Fitch. Ethics can confirm consent by communication. It's been done before. I need a legal sign-off and an OR by 6. Fitch looked at his folder. He was the kind of administrator who tracked liability before he tracked people, and the math had just shifted under him. I'll make the call. Braun stepped toward Fiona, not a large man, but positioning himself the way men do when they've run out of arguments and try size instead. You have single-handedly disrupted this patient's care plan. His care plan was a warehouse transfer. I disrupted that. You will be reviewed for overreach, for insubordination, for... Put it in writing, she said. Everything you want to say to me, write it down. I'll do the same. He looked at her a long moment. Something in her face stopped him. Not the rank, not the record, but the particular absence of fear that comes from having operated in places where the thing you're afraid of isn't a senior physician in a hospital corridor. He left without another word. Anand exhaled. Fiona turned to Cora. You should know he's been hearing you. Everything you've told him about the dog, your daughter, the yard, all of it. Cora made a sound with no name in any clinical vocabulary. She turned to her husband, took his hand, said his name twice. His finger moved once. Yes. Fiona left to give them the room. In the hallway, she pressed her back to the wall. 4 counts in, 4 hold, 4 out. Anand appeared beside her. You okay? Yes. You don't look it. I'm fine. How long for the OR? Fitch will clear it. He doesn't want this reaching a hearing any more than I do. Anand paused. How did you know that tapping pattern, the one he was using? Fiona looked at the closed door of 308, field code. Force Recon uses it for covert comms. How does a VA nurse know Force Recon field codes? Fiona said nothing. Anand looked at her sideways. Where were you before Eastbrook? Different hospital. Fiona picked up her chart. Anand didn't push. She had the intelligence to know when a door wasn't going to open and when to leave it alone. They took Dolt to surgery at 6:40. Fiona walked beside the gurney to the elevator, which wasn't strictly required and nobody said anything about it. Cora walked on the other side. Dolt's hand lay against the rail. At the elevator, Fiona leaned close. You held on for 4 months, Thomas. Don't let go now. His finger moved once. Then again, not a tap this time, a different gesture, 2 fingers pressed flat. She recognized it. She'd last seen it used at a forward operating base in Helmand Province, in the dark, when words were too expensive. It meant, I trust you. Her throat did something she didn't let herself examine. She stepped back. The elevator closed. Surgery lasted 3 hours and 11 minutes. The hematoma was smaller than the worst outcomes and larger than the best ones. The kind of math neurosurgery runs on. Anand sent a resident to update Fiona at the 2-hour mark. Fiona sat with Cora in the family waiting room, where Cora had eaten nothing and had no interest in being managed by anyone. At 9:42, Anand appeared in the doorway. He's stable. Decompression was successful. We won't know function until he wakes. Cora stood, but the pressure is off? The pressure is off. Cora sat back down immediately, as if her legs had simply decided the emergency was over. Fiona caught her elbow. Easy. I'm fine. Cora steadied herself, pressing her hands flat on her knees. He kept his hand on mine when I talked to him. 4 months, I thought I was imagining it. You weren't. Why did you believe him when no one else did? Fiona considered the question. The honest answer was layered in places she didn't open for people she'd known for 4 months, or 14 or longer. She gave Cora the part that mattered. Because I know what it looks like when a trained person is trying to communicate under conditions where communication isn't supposed to be possible. He was working hard to reach someone. I happened to speak the language. Cora nodded slowly, the way people nod when they're storing something rather than responding to it. Braun's office lights were still on at 10:15. Fiona saw the glow under his door and didn't stop. What waited at the nurse's station was worse. Douglas Fitch sat in a chair with his folder open, flanked by 2 people Fiona hadn't seen before, one from hospital legal, one from the State Medical Board Oversight Office. This had escalated faster than any regular process could explain. Nurse Cassidy, we need to discuss your conduct today. Fiona stopped. The East Corridor was empty at this hour, just the 2 of them, the 2 officials, the folder, and the silence that precedes formal consequences. She thought about being quiet. She'd been quiet for 14 months. She thought about being strategic. She'd been strategic for 8 days. She thought about Thomas Dolt spelling wrong, heavy, pain, HEAD, with a finger he wasn't supposed to be able to move purposefully, in a pattern from a field operation with no paperwork in any civilian record. Before we discuss my conduct, she said, you should document that your chief of neurology scheduled a patient for long-term placement transfer, despite 8 days of documented responsive communication, indicating active medical deterioration. I filed that documentation. If the board is here, they should see it first. The legal representative looked at Fitch. Fitch looked at his folder. Additionally, Dr. Braun ordered that consult cancelled after imaging confirmed a surgically treatable lesion. Had he succeeded, Gunnery Sergeant Dalt would have been transferred to a long-term facility with an active epidural hematoma, a prognosis now revised by operative findings. The board representative uncapped a pen, full name and credential? Fiona Cassidy, Neurology, Eastbrook Veterans Medical Center, Employee ID 4471. And Dr. Braun's conduct today. I'll tell you everything. But I want it on record that this patient survived tonight because someone listened to a communication protocol his attending dismissed without investigation. She looked at Fitch. That's the first line of whatever report you write. Fitch's folder hadn't moved in 60 seconds. Dr. Braun has concerns about the scope of your intervention. Dr. Braun has concerns about a patient who stopped being useful to him the moment someone proved he was still thinking. She held Fitch's gaze. Ask him why a minimally conscious combat veteran with no recovery pathway was already being considered for a clinical research consultation at Meridian Neurosystems. I can spell the company name if you need me to. The pen stopped moving. Fiona hadn't intended to use that card tonight. She'd found the Meridian correspondence 3 days earlier, in a misrouted fax that landed in the wrong tray on the neurology floor. Braun's name, Dalt's patient number, language about appropriate candidate profile. She'd photographed it on her personal phone and said nothing, because she hadn't had enough yet. She had enough now. How did you access? The board representative started. Misfiled document. Patient-related correspondence in a shared clinical fax area is accessible to nursing staff. She set her phone on the counter and pulled up the photograph. Here. The hallway went very quiet. We need to make some calls, the representative finally said. What happened next wasn't a scene. It was a series of quiet administrative facts, which is how the worst things in hospitals actually end. Not with confrontation, but with paperwork that makes confrontation retroactive. Braun was placed on administrative review pending investigation by 7 the next morning. Meridian Neurosystems received a compliance inquiry by noon. A patient advocate was assigned to Thomas Dalt's case by afternoon rounds. Fiona received a formal notice of commendation from the patient safety office. It sat in her locker under her street clothes, because she didn't have anywhere else she needed to put it. She was in room 308 at 8:17 the next morning, when Dalt opened his eyes and held them open. Not the half-open vacancy of 4 months, open tracking, finding her face and staying there. She picked up the alphabet board, Thomas. He looked at it, he looked at her, then not a tap, not a pattern, not a code, his lips moved, no sound, but the shape was clear. She read it the way you read lips when the room is too loud for words. Thank you. Fiona set the board on the bedside table and put one hand near his. Not on it, because he wasn't the kind of man who needed to be held, and she wasn't the kind of woman who assumed. Don't thank me yet, she said. Rehab is going to be the worst thing that's ever happened to you, and you've been to Helmand Province, so that's saying something. His mouth moved again, something that might have been the start of a smile. Cora arrived at 9, stood in the doorway and looked at her husband's open, tracking eyes for a full 15 seconds without moving. Then she went to him, and Fiona went to the hallway, giving them the kind of privacy no protocol had ever been written to describe. 3 weeks later, there was a meeting on the neurology floor, unlike any that had come before it. A patient advocate, 2 neurosurgeons, the chief of nursing, a representative from the VA regional office, and Anand, who had apparently slept about 4 hours a night since the surgery, and showed no signs of stopping, sat around the conference table with a proposal. The Veteran Cognitive Status Protocol, a mandatory secondary communication assessment for any TBI patient classified below responsive baseline, required before any transfer or placement decision could be finalized. Named for the case that had generated it, though the file itself used a number, not a name. Fiona was asked to present the communication methodology. She stood at the head of the table in her cerulean scrubs with a printed sheet and no notes she needed, and explained the tapping code, the letterboard sequence, the specific symptom reporting that had identified the evolving hematoma. She used clinical language because she was in a clinical setting, and she had learned long ago to speak the language of the room she was standing in. When she finished, Anand said, "Can I ask something off record?" Fiona looked at her. "The field code, where did you learn it?" The table waited. Fiona had been asked this 3 times in 3 weeks by 3 different people, and had given 3 versions of an incomplete answer, each one true as far as it went. She gave the full version now. "I served with the Navy as a Fleet Marine Force corpsman, attached to Marine Force Recon, 2nd Battalion, 2 deployments in Afghanistan. I received a medical discharge after a spinal compression injury in my 3rd year." She paused. "My call sign was Anchor. I learned that code on the same rotation Gunnery Sergeant Dalt served his first deployment. I didn't know him personally. I knew the language. The table was silent. Your employment file doesn't reflect military service, the VA representative said slowly. My employment file reflects what I was required to disclose. Military medical history with non-disclosed injuries is covered under privacy's protocol. You have a call sign. I had a call sign. I have a nursing license now. They're not mutually exclusive. Anand almost smiled. The protocol passed unanimously. Fiona was asked to serve as clinical training lead for communication assessment. She said yes. It was the useful thing, and useful was the only category that had ever mattered to her. She stopped by room 308 on her way out that afternoon. Dalt sat in a rehab chair by the window. Impossible a month earlier. His wife sat beside him. His daughter, Lily, 11, with her father's dark eyes and her mother's steady hands, showed him something on a tablet with the patience of a child who'd learned to wait. He looked up when Fiona came in. She nodded once, the way you nod at someone who doesn't need words. He tapped 2 fingers on the arm of the chair, flat, slow, the same gesture he'd given her outside the elevator. Trust. She tapped 2 fingers against the door frame on her way out. Returned. In the locker room at the end of her shift, Fiona changed out of her cerulean scrubs and sat a moment on the bench with her street clothes in her lap. She hadn't thought in a long time about what she was. Nurse, everyone called her, and it was true, the truest thing about her life for 5 years. But it had always been true alongside other things she'd filed under classified in her own head, telling herself it was safer, cleaner, less complicated not to explain. Thomas Dalt had been trapped inside a language nobody was trying to speak. She had spoken it, that was all it took. That was also everything it took. She thought about the people in other rooms, on other floors, in other buildings like this one, tapping against rails and getting no answer. She pinned her locker shut, picked up her bag and went back to the desk. I want to look at the census, she told the charge nurse. Everyone below a level 2 responsiveness classification. Pull the last 60 days. The charge nurse looked at the clock. It was past shift end. Fiona sat down anyway. I'll be here a while. She had learned, in every environment she'd ever operated in, that the hardest part was never the crisis. The crisis had adrenaline to carry it. The hardest part was the patient work after. The slow, deliberate, unglamorous effort of finding the ones who were still there, who had simply stopped being heard. She opened the first chart. She had a lot of work to do.